All right, so we're going to get started here with chapter 17. This is the chapter about reproductive system diseases and disorders. This was a challenging chapter in person class, like in seated class, so we'll see how this goes with online. Let me know if you have any questions. The book is pretty descriptive here, and there are lots of pictures and stuff in the book. People last semester were pretty shocked. I don't know how in-depth you guys need to know about this in your mental health rotation, but I left it in because people are going to talk to you, and there are going to be some things you need to know about STDs and things of that nature. So I went ahead and left this chapter in, but just know that you need to be comfortable talking about the reproductive system. And so the more you know, I feel like knowledge is power. So we're going to dive right in here. So the anatomy and physiology, there are different structures there that you can see for the female external structures. Don't need to have those memorized. There are some internal structures, and there are different hormones that go along with the female anatomy and physiology. There are the male external structures and the male internal structures. So difference between male and female there. There are some different common signs and symptoms for female reproductive disorders. Some females will have abdominal and pelvic pain, fever and weakness, abnormal vaginal discharge. Don't think that your clients aren't going to say this to you, because they will. You need to be comfortable enough to hear it. They might have burning or itching of their genitals, pain during sexual intercourse, any changes in their breast tissue, abnormal discharge from their nipples. Males are going to have urinary disorders, frequency, dysuria, nocturia, incontinence. Just essentially means that they're going either more frequently, they're going at night. It's not a normal pattern of going to the bathroom. They're going to have pain in their pelvis, groin, or reproductive organs. They might have lesions on their external genital area, swelling of their organs, abnormal discharge, burning or itching. This is something I hear more often than what you would think. Now, I might, as a provider, hear it more, but you need to be listening for people when they're talking to you about how often they go to the bathroom, especially in men. If they're saying that they're having to go to the bathroom a lot, that's not necessarily normal. And especially if they say, oh, I try to go to the bathroom and I have to stand there for like 2 or 3 minutes before I can actually go, and then I don't feel like I've went enough. That can be a huge red flag for prostate problems. So just keep that in mind and let them know that maybe they should get checked out. There are different tests for females. One of the tests that you need to know about is that females need to have a pap smear. That's one of the most important ones that you need to know about. There's some more tests, mammograms, you need to know about. This is a laparoscopy test. This is just kind of showing what they do there. It's not something you need to know. I just put it in there for picture. Men have the famous digital rectal examination, usually with their test. That's important for you to know. PSA tests are checking for that prostate problem. One other thing that I would add there, and I don't know if it's on your exam or not, is that all men, just like women, should be doing breast exams. Excuse me. Men should be examining their testicles and making sure that that there's no lumps or bumps that are abnormal, because testicular cancer can happen in boys and young men, all the way down to the age of like 16 and 17. And so it's important for men to be checking those areas, just like women should be checking their breast area. All right, so let's talk a little bit about diseases. There's premenstrual syndrome. This is one that's made fun of over and over again. Are you PMSing? People, especially like in high school and junior high, boys like to say that. And sometimes men or women themselves will blame any kind of irritable mood instability on PMS. And this just includes symptoms prior to their menses. And it can begin mid-cycle, including headache, back pain, nausea, swelling, bloating, weight gain, irritability, mood swings, depression, breast tenderness, sleep disturbances. And they're going to try diet changes first, avoiding caffeine, chocolate, nicotine, salt, sugar, and alcohol. They can have different problems with their cycle, and all these are just any abnormality essentially is what you need to know here, that if they don't have a cycle, if they have a cycle too much, if their cycle is too little, you know, any kind of abnormality. The female cycle should be, I think they say 3 to 7 days. If it's more or less than that, then there's something wrong. Menopause is the natural halting of menstruation. It's not a disease. It's a normal physical change related to aging. It usually takes place between the age of 40 and 50, and it can be surgically induced at any time by removing both of the ovaries. They're going to get hot flashes, night sweats, and vaginal dryness. For some women, they can have depression, sleep disorders, and decreased libido. They're going to do blood tests to check for FSH. That's the hormone there that they're looking for. And then they'll give them hormone replacement therapy on an individual basis. Not everyone gets that because there's side effects from that. All right. Vaginitis is just, you know, itis there is inflammation of the vagina. It can be bacterial or yeast. They're going to have different symptoms there, as you can see, and they're just going to culture it, see what's causing it. They're going to treat it by identifying and treating what's causing it, and they want them to abstain from sexual intercourse until that is healed. So the big thing to know here is anything that's abnormal there that they're talking about that should be checked out. Endometriosis is an abnormal growth of that endometrial tissue outside of the uterus. Common implantation sites would be the ovaries, fallopian tubes, abdominal walls. This can cause significant and serious pain for some women. I had a client who, you can see here that they have really bad periods and they can be infertile. So I had a client who was, let's see, probably in her 20s, maybe mid to late 20s. Never wanted to have children. Was in a long-term relationship, but had severe endometriosis and begged and begged and begged her physician to do a hysterectomy because the pain and the horrible cycles, and they would not do it because she did not have children. Pelvic inflammatory disease is inflammation of some or all of the pelvic reproductive organs. So this can be caused by STDs usually. They're going to have fever, chills, pelvic pain. They're going to treat it with antibiotics, pain medication, rest, and they want them to use safe sex with proper use of condoms. Ovarian cysts, this can be a commonly benign fluid-filled sac near the ovary. There's different types, but most of the time these people are going to have back pain, pelvic pain. They're going to have nausea and vomiting. And the treatment's going to depend on the type and the size. And sometimes these go away by themselves. Fibroid tumors, these are a little bit different. These are benign tumors of the smooth uterine muscle. These are the most common tumor of the female reproductive system, but they can cause severe menstrual bleeding and pain. And like I said, it's going to be dependent on the woman's age, but most of these women have typically had a hysterectomy. Toxic shock syndrome is a severe life-threatening illness. This is found almost exclusively in menstruating females using tampons. It's caused by staph, and it's a sudden onset of high fever and vomiting. I remember when I was in like junior high or high school, there was a girl who fainted, and the big thing was that she had toxic shock syndrome, and it went all over the school, and everybody was afraid. They're going to give them IV fluids and antibiotics. It can be life-threatening, though. There are people who have died from this. Uterine prolapse, you don't really need to know a lot about this, but just know that there was a client not that long ago that had this. But the uterus actually protrudes out into the vagina, so it will actually hang out of the vagina. This can be very uncomfortable and embarrassing for people. So just try to be understanding if you have a client or know of a client that has this. and obviously they're going to have to have a hysterectomy. Cystocele, this is a herniation of the urinary bladder through the vaginal wall. Again, this is very embarrassing. These people are going to have a hard time with going to the bathroom. They're going to want them to do Kegel exercises. If you don't know what that is, please let me know, for you females out there. And then they're going to do surgery. A rectocele is a herniation of the rectum through the posterior vaginal wall. I have never heard of this. I mean, I've heard of it. I'm sorry. I've never seen this. And I've never had a client tell me that they have this. But the symptoms are discomfort, constipation. They're going to have a hard time holding their stool. That's what fecal incontinence is. They're going to go in and do surgical repair. You can have constipation and seemingly diarrhea at the same time. Sometimes there will be like a hard area of stool there, and little bits of diarrhea will leak around it. Cervical cancer, the most common cause is HPV. You've all, I'm sure, heard of the HPV vaccine. Still somewhat controversial. I haven't chose to have, my kids are current on their vaccines, but I've chosen not to give them this one because there's still so much that is undocumented about it. But a lot of people have gotten it, and they say that it can prevent cervical cancer, but cervical cancer can cause cervical bleeding, and they're going to do surgical removal of the tumor. So there you can see the risk factors there. You know, smoking's there as a risk factor, sex with males who smoke, which I thought that was super interesting when that was in here. But there's all those risk factors, excessive alcohol consumption, but they want people to get that HPV vaccine. Uterine cancer develops in the endometrium and spreads to the uterine wall. They're going to have abnormal bleeding in the postmenopausal females, and they're going to remove it. Ovarian cancer is common and fatal. This is such a sad disease, because a lot of times women don't catch it until it's too late, because the feelings that they have are just kind of feeling run down. They might have some abdominal pain, but they just don't catch it soon enough. They're going to do a hysterectomy, radiation, and chemotherapy. I do know of a woman recently who had this and survived, so that's really good. Fibrocystic disease is the most common breast disorder of premenopausal females between the ages of 30 and 55. This can be linked to estrogen levels, and they're just going to treat to decrease the pain that goes along with this. They want them to reduce caffeine and salt, use diuretics, and use pain medication before they're going to start their period. Mastitis is an inflammation of the breast tissue. This is a lot of times happens in breastfeeding women. Breast cancer is the most common. Breast neoplasm is that adenocarcinoma of the breast ducts. Risk factors are 40 and over. That's why they want women at age 40 to start getting a mammogram. Family members affected with breast cancer is a risk factor. Those women need to be checked sooner. And early onset of menses is a risk factor. There's some more there for you. People who have not had children, that's what nullipara is, or the first child after the age of 30. Brassiere wear time. So they talk about people who wear their bras a lot is a risk factor. They might have a non-tender lump of varying size. Most often occurs in the upper outer quadrant. And dimpling is just, I don't know how to describe this over. Well, think about cellulite. Kind of would look like that, except on the breast. And they're going to try a lot of things. They might just take the lump out. They might do a mastectomy, which means they're going to take the breast off, chemotherapy and radiation. Ectopic pregnancy, this is when the fertilized ovum attaches to the tissue outside of the uterus, usually in the fallopian tubes. So when that fertilized egg normally implants in the uterus, instead it only makes it to the fallopian tubes, which is not viable there. They're going to have acute pain, vaginal bleeding, but they will have a positive pregnancy test. and they're going to do surgery, and usually they lose that tube, which can be very sad for some women. And there you go. So the middle part there is the uterus, and it can implant in all of those areas that you see, but it should be implanted there in the middle. Spontaneous abortion is a natural termination of pregnancy before the fetus is viable. This is known as a miscarriage. They're going to do a D&C, but it's often difficult to stop once they do try. Morning sickness, this is going to be associated with the first trimester of pregnancy. They're going to have nausea, vomiting. So it's not a lot of times they will just let women, I hate to use the word suffer, but it really is suffering through this unless they have excessive vomiting. I think that, what was it, the lady who is in England over there, Kate Middleton, I think she had severe morning sickness, and so she kind of brought some new light to this, which this is what she had, hyperemesis gravidarum. This is apparently what I read that she had, which is excessive vomiting, and you can get dehydrated, lose weight, electrolyte imbalances, which is not good when you're pregnant. Toxemia is a disorder of pregnancy. It's going to appear during the 3rd trimester. They're going to get hypertension, sudden weight gain. They're going to have protein in their urine. Their face, hands, and their feet are going to swell, and they're going to monitor their blood pressure, weight, and urine protein. Prostatitis is a male reproductive system disorder. This is going to be inflammation of the prostate gland. They're going to have some problems going to the bathroom, low back pain. They're going to give them antibiotics. They're going to give them pain medicine. They're going to want them to increase their fluid intake. BPH, or benign prostatic hyperplasia, this is enlargement of the prostate gland due to the normal cells overgrowing and enlarging. This is common in men over the age of 50, but can happen in men younger. They're going to have a hard time. They're going to need to go to the bathroom more frequently, and usually this is in the night. And there you go, I kind of was talking about earlier about the inability to start urination, and they're also going to have a weak urine stream and the inability to empty their bladder. They have prostatic massage. I've never seen that or heard too much about that. They might have to catheterize them to empty their bladder. Regular sexual intercourse will help with that, and surgery. There's a new surgery out that I've heard that is to fix this. That's just this new breakthrough kind of thing. So we'll see what comes of that. There's the surgery though, the current one. It's transurethral resection of the prostate, a TURP, very common surgery. And you can kind of see they're going in there and they're cutting pieces of that prostatic tissue out to make room so that the people can empty their bladder. Prostate cancer is what this is. It's a cancer of the prostate gland, affects men usually over the age of 50. It's the 2nd most common cause of cancer-related death in men, similar to BPH, what we just talked about. But treatment's going to depend on the age. There was one gentleman that I knew when I was younger, and he had prostate cancer, but they said that he was going to die of old age before the prostate cancer was going to kill him, so they didn't even treat it. Okay, so here is inflammation of the epididymis. This is I have never had any clients come in and talk about this. I'm sure I've had clients that have had this, but this is severe scrotal pain and swelling, and these people are usually in quite a bit of pain. They're going to want them to rest. They don't want them to have any sexual stimulation, avoiding spicy foods and alcohol. This is inflammation of one or both of the testes due to a viral or bacterial infection. They're going to have pain, tenderness, fever, general feeling of weakness, and if it's a bacterial cause, they're going to give them an antibiotic. Testicular tumor, this commonly affects young males between the age of 20 and 35. This is what I was talking about earlier. It's the most common type of cancer in this age group. That's why it's so important for men to do testicular exams, even starting young. And it's going to be a painless mass felt in the testicle. So they don't know that it's there unless they check. And so doing this lecture is reminding me, my son is 15, reminding me to talk to him about this and let him know that if there's anything, I'll probably have his dad talk to him, but if there's anything abnormal in that area, that he needs to talk about it. So that orchiectomy is, they may have to go in there and remove that testicle, or chemotherapy and radiation. All right, there is this an undescended testicle. This is usually at birth, and so that's usually when they catch this, and they just usually will call it an undescended testicle, and they usually will know it when they're born, and they'll do surgery to bring that testicle down. There you go. There's a picture. All right, let's talk a little bit about STDs. These used to be called VD, or venereal diseases. This is a group of diseases that are spread by intimate or sexual contact. Its treatment commonly consists of identifying sex partners and treating the infected individuals, but prevention is key. You have AIDS. This is a bloodborne viral infection. It's discussed in Chapter 5. Keep in mind that there's now a quote-unquote cure for this. It's not really a cure because you still have it. It doesn't go away. It's kind of like hepatitis. You still have it, but you're not going to die from it anymore, and it's not impacting your body, but you're still a carrier of it. I don't think you can transmit it anymore, though, but it'll still show up, is my understanding. Hepatitis we've talked about. Genital herpes, that's a viral infection of the mucous membranes. It's caused by the herpes simplex virus. This causes blisters, extreme pain, severe itching, painful urination. This can be very detrimental for some people, because think about, I've never had a cold sore. Same virus, I say it's the same, it's a little bit different, but a cold sore, my understanding is that same sore is in the genital area, or similar sores in the genital area. And from what people tell me, like I said, I've never had a cold sore, thank you, I'm so glad, but they are very painful from what people say. And I've heard people tell me they can feel it start to tingle before they get it, and then it will erupt and cause them significant pain. And my understanding is it's this very similar for the STD. They're going to give them antiviral medication, sitz bath, ice therapy, and pain. No cure for this. Surely someday they'll come up with a cure, though. Gonorrhea, the most common STD in the United States, one of the most common. It causes inflammation in mucous membranes of the genital and urinary system. It's caused there by the gonorrhea bacteria, and it causes a purulent discharge from the penis and vagina and some trouble with urination. So it's going to be, from what I understand, I've never personally seen a vaginal exam for this, but my understanding is the discharge that comes is very has a strong odor, and is usually like a green yellow discharge. It can cause urinary frequency in males and females, genital itching, burning pain, inflammation of the cervix in females. They're going to treat it with penicillin, tetracycline, antibiotics is what they're going to treat it with. Syphilis, this can be life-threatening, and there are different stages of syphilis. There's a primary stage where they have a painless canker that appears. Secondary, the canker is going to heal, and they're going to have a rash that appears. And then there's tertiary, which can last 6 weeks to 1 year, and the bacteria can invade the body. It is curable with antibiotics during this stage, but the effects of the lesions are irreversible. Syphilis years ago used to be a pretty bad problem, and people would actually have brain problems from this, and it wasn't good, but they're going to treat it with antibiotics. Chlamydia, very common, one of the most damaging STDs, also known as the silent STD. It's bacterial in nature, and it causes drainage, burning and itching with urination, abdominal pain, and they're going to do antibiotics. I had a client come in not that long ago, younger variety, maybe 15, not driving yet, 14, 15, and said that they had been to the health department and just recently been diagnosed with chlamydia. So you will hear about this. Trichomonas is a common STD affecting approximately 10% of all sexually active individuals. This is a protozoan. This is interesting. If I have seen this on a slide before, and it's very, very interesting to see that move. And but in men, they often don't have symptoms at all. Females are going to have itching and burning and a green frothy vaginal discharge. And it's a parasite, so they're going to give them anti-parasitic medications. Genital warts, one of the most common STDs, warts that affect the warm, moist tissue of the genital area. This is caused by the HPV virus. Now, just because you have genital warts doesn't mean that you have the HPV that is going to cause cervical cancer, so that's an important differentiation to make there. Symptoms are going to be tenderness, discomfort related to the size and number, and they're going to do chemical or surgical removal. And it is common in females with genital warts, but it's not always the case. All right. So this is just going on. You don't really need to know a lot about this. Just know that there are some men and women who have pain or discomfort with sexual intercourse. There are some women, I think more women than men, who don't find that enjoyable and actually have pain. And this can be not just because of a physical problem, this can actually be a psychological condition. And so you will likely hear about this. And it can be very traumatizing that this isn't something that you enjoy that everybody else does. There can also be orgasmic dysfunction. And this is also somewhat damaging to people, and it can be due to a psychological condition, but can also be neurological. And these women don't have the ability to reach orgasm, and you're going to want to give them education on healthy sex attitudes, and you probably won't, but maybe you can get them to their physician who can. For men, they have impotence or erectile dysfunction, most commonly known as ED. There are medications that they can give them to help with this. It doesn't affect fertility, but keep in mind that this is generally older men, but in younger men, this can happen and usually is due to something else that's going on. Treatment varies. Like I said, there's medication, surgery, psychological counseling. Diabetes can cause this also, so keep that in mind. Men who have diabetes, and if it's severe at all, this can happen. You may not be able to prevent this, but they can do activities related to a healthy lifestyle. There are some men who have premature ejaculation. This is an expulsion of the seminal fluid before they intend to, and this is most commonly in younger males. Infertility, this is the inability of the couple to achieve pregnancy. Female causes, it might be an STD, hormones, abnormality of the reproductive organs. Some women aren't born with very many eggs. Some men have low sperm counts. Some women have vaginal antibodies that kill sperm. Kind of talked about that. Trauma, of course, there's rape. This is sexual intercourse without consent. This can be at any age and against either sex. There is a high incidence, there's date rape drugs, and it is a difficult recovery when this has happened. Aging on females, you can see there, I think the aging in this area is generally easier for females than it is for males. All right, post any questions that you have, and hopefully that was somewhat painless, and we will move on to the next chapter.